Good guy. We're getting to know each other, are we? Huh?
Boris was born with a cleft palate, a genetic deformity which leaves a dangerous hole between the roof of the mouth and the softer palate behind it.
Is it true? Are you a tough guy? You've had to be a tough guy, haven't you?
Puppies born with this affliction are normally euthanased immediately. That's exactly what would have happened to Boris if vet nurse Jess Warby hadn't stepped in.
It was quite stressful. A lot of us didn't know if he would survive. We had to put a tube into his stomach every 2 hours to inject milk to feed him, and it was touch and go.
It's okay, buddy. It's okay. Yeah. He would have had quite a few infections, I'd imagine, along the way.
He gets them quite regularly.
Just from the food pushing up into his nasal cavity and carrying bugs.
In his short life, Boris has endured 7 operations.
He's had ear cartilage harvested to try and fix a hole that didn't work. He's had a plate fashioned, like holes drilled in his gums, and that also didn't work.
Oh, wow. Okay.
If I don't do anything, he will get to the point where he'll just be very sick, and yeah, it'll be time for him not to be with us any longer, which is really scary for me. Good boy. Good boy.
Chris will now arrange for Jess and Boris to meet with surgeon Andrew Marchevsky at SASH.
So basically, you're my last hope.
No pressure.
No pressure. No pressure at all. Very excited, aren't you? Yes.
Jess has arrived at SASH to find out Boris's fate.
One way or the other, I'm going to know which way it's going to go. So, scared in case it's not good news. He's my life.
Surgeon Andrew Marchevsky and dental expert Nadine Fiani are the team in charge of Boris's future.
Wow, it's quite the hole.
3D scans show Boris's condition is much worse than anybody expected.
He's got a loss of bone basically from his nose all the way down to the back of his throat, but it's actually probably about twice the size of the actual hole that we can see. We're going to have to be creative and radical to try and get this closed. We've got to give it a red hot go.
In all honesty, I think what we could do is actually extract these teeth, so we might have to stage the procedure.
It will be the first time this groundbreaking surgery has ever been attempted in Australia.
What we'll do is extract these teeth,
Take these out.
Take them out. Take them right out. Once that all heals, it'll allow us to have an extra centimetre of tissue that we can close up with, and a centimetre goes a really long way in the mouth.
Well, I think we can do something.
You do? Really?
Yeah. It's not going to be easy.
Okay.
And it's going to take a while.
Okay.
And it's not going to be one procedure.
Okay.
I think we can do it.
You think you...
I think we can do it.
Well, that was more than I was expecting to hear.
I've got to tread very carefully with this because Jess has come here with high hopes and low expectations, and I don't want to give a false hope. It's nice to get an opportunity to get something as bad as this sorted, so...
You say that now. You don't know what you're getting into. Thank you so much.
All right, Jess.
Thank you.
This is his last chance. If we can't do this now, it's not going to get done. So it's going to be tough.
Had a call from Jess and it's great news. She is going to go ahead with Boris's surgery. It's a big decision. They just need to raise so much money, and that's why I'm heading up to see them again today. They've got their local doggy day out on, and I'm hoping I can lend a hand with some of the fundraising. Should be fun.
In money for Boris to have an operation. Yep. They're $1 each or $65.
In New South Wales Hunter Valley, Jess is hard at work selling raffle tickets.
Good. Hey, Boris, it's a big day, buddy. It's a big fundraising day. We're raising plenty of money with kisses. Is that what you're doing? Is that how you're doing it, is it? Huh?
Boris is running out of time, but $8,000 needs to be raised to pay for his cleft palate operations.
Hopefully everyone understands it's for him and he can stay with me forever then, instead of just a short time.
Who wants to buy a raffle ticket? Yep. I'm already going here.
$1 each or $6 or $5? Yeah, I'll get you some change.
I'd like to donate $20.
Yeah, oh, good on you. Thank you.
For a kiss.
For a kiss. Who gets the kiss? Is it Do I get the kiss or you? There you go. Easiest $20 I ever made, or Boris ever made.
Happy birthday, Boris!
Happy birthday, Boris.
There's another reason to celebrate today. It's Boris's second birthday.
Hip hip. Hip hip.
And right now, he has no idea what lies ahead.
Look at him go!
It's been a massive challenge for Jess to bring up a dog like Boris. But to now try to raise money, this has been one hell of a mountain to climb for her. She's doing well so far, but it's not over yet.
Yes, and I will eat more cake.
Hi, Jess. How are you? Hi, Boris. Hi, Uncle Boy.
The day has finally arrived for the first of Boris's radical operations.
I'm a little bit scared to get my hopes up too high and get my heart broken again. Okay, you be good boy.
All right, Jess, you be brave too.
Thank you.
All right, come on, Boris.
Bye.
Good boy. Oh, I'm happy to leave. Yeah, come on.
If today's surgery doesn't work, Boris is on limited time. Most cleft palate puppies are put down at birth.
What we're seeing is the tip of the iceberg. The actual real hole is probably twice that size because there's no bone underneath this, which there should be.
Dental surgeon Nadine Fiani is heading the revolutionary operation.
We are going to take the teeth away in order to give ourselves as much tissue to be able to close that hole off. And at the moment, it's really the teeth that are standing in our way to reach all that lovely, lovely, healthy tissue in the cheeks.
But his teeth are perfectly healthy, and so they're in there rock solid. And it's not just one tooth, there's 9 or 10 we're going to have to take out like this.
In this case, a little bit of muscle does help.
Boris's smile may never be the same, but he's been left with enough teeth to be able to eat normally.
Oh my God. Right, it came. Bone is intact. Okay, so that was the last one. I am absolutely thrilled with how everything went today. There were definitely difficult extractions, but I think we got everything out and we managed to conserve as much bone as possible. And that's the most important thing because that's going to be our scaffold next time.
Basically, we've done half the job now. The really important part's what we've got to do in a few weeks' time, and that's actually close the hole. Up you go. Which puts a bit of pressure on because it's not fixed yet. I'm sure Jess knows this is her last crack at it, and it's Boris's last crack at it as well.
Papa!
Hi, Boris.
Hello.
Say hello to your mum. Come on. Out you come.
Oh, Papa!
Yeah, a month to wait.
Means one more procedure. One more.
Fingers crossed.
If this fails, we're done. You know, we can't do anything else. Hello.
Hi.
How are you?
Good, how are you?
Good to see you.
Good to see you
No,
again.
this should be the last time.
I hope so. No offence.
It's 3 weeks since Boris had 10 teeth removed in readiness for today's final and most important surgery.
Last night in bed, I might have had a few little dark thoughts about the what if and if something goes wrong, but we've fought too hard and he's fought his whole life, so he's here against all odds.
Come on, buddy.
Bye, Bubba. No, you need to go.
You gotta go, buddy. Come on.
Be good.
Come on, Boris.
Be
Come on,
good.
buddy. Come on.
This is the last chance to fix the dangerous hole in his mouth.
The tricky thing about today is that it's not like 95% of the work has been done and we're almost there. This is the hardest operation, the trickiest operation, and the operation that's probably most prone to failure.
Yeah, Nadine kept it quite quiet, but this hasn't been done very often. Did you?
I did, yeah.
Yeah.
Sorry, I'm quite nervous about it.
Boris has had so many different operations and so many different people along the way trying to help him out, but the situation has now become so desperate. We're having to do an operation that's never been done in Australia before, and it's only the second time in the world.
And just undermined all that tissue so we can then just flip it across and just go over the hole there. And then we'll be able to suture that to the bone on this side, and then we'll suture another flap of tissue over the top of that.
The surgery is slow and painstaking. After a marathon 4 hours, it's finally complete.
Righto.
Awesome.
We're done.
Well done, guys. Just to say. I have my doubts, but in terms of how it would look, but it's...
Ye of little faith,
It
Dr.
actually,
Brown.
it looks very good. Hello. How are you?
I'm good.
You know you were hoping for a good result?
Yeah?
You just got it.
Oh my God, are you serious? How good of a result? Oh my God, are you serious?
Yeah. He's gone really well.
Really?
Yeah, really
There was
well.
plenty of tissue?
Yeah.
Oh my God.
It's taken a lot of work from a lot of people to get to this moment, but honestly, the only thanks any of us needed was to see Jess's face.
Oh, I can't believe it's all done. It's all done, it's all over, and it's good. Oh, Papa! Oh, Dad! Oh, you look sore.
He looks tired, doesn't he?
Oh.
You just can't forget it's been such a long and a really tough journey to get to this point. And even though Jess wasn't in that surgery today, it was her that fixed Boris. She saw something in him from the start that was worth saving. She wouldn't take no for an answer, and today, she got a reward.
2 months later, Boris is fully recovered and the ordeal is finally over for Jess.
I think he's better looking now. Now he's got the fangers out, it makes him look tougher. I know. It's done, he's fixed. Now we can just relax and just enjoy life.
Come on, let's go.
You just can see that she hops more than separates and runs, you know, and you can just sort of see that she's in a bit of pain.
Just come on, come here.
Brooklyn is just a year old, but she's already battling debilitating arthritis in her hips and back legs.
She struggles with stairs, even just in and out of the car. There's a bit of a struggle.
She can't get into the car.
Yeah.
And then when she gets out, she kind of waits, like, for you to kind of give her a little bit of support.
Go on, get in there.
The only reason she can move around now is daily painkillers.
She looks like she's a 90-year-old woman.
Look at that. She's got no strength there.
Ollie and Sasha have arranged to meet up with their friend, emergency vet Lisa Chimes, for advice.
My concern is that Brooklyn's got something called hip dysplasia, so it's a genetic problem. They're born with it. It is so much worse than you described. I honestly am shocked. A hip should be a ball and socket, and in Brooklyn's case, I fear that her socket is underdeveloped, so the ball doesn't sit in the socket, it slips out every time she walks. It's not a curable disease, so we have to do pretty drastic surgeries to fix it.
Okay, come on. Here you go.
So what we need to do now is get Brooklyn over to Sash, get the surgeons to have a look at her and take some x-rays to see exactly what's going on. My worry is that there's going to come a time, which is going to be pretty soon, where she's going to be so crippled that she won't even be able to get up.
Yeah, she's certainly very under-muscled.
Ollie and Sasha have brought Brooklyn in to see specialist surgeon Andrew Marchevsky.
Okay, you're all right. Good girl.
The French Mastiff is only a year old, but already crippled with painful arthritis in her hips and back legs.
So this is her hip joint, right? So it's a ball and socket joint, and what her hip at the moment is, it's sitting out there, and every time she walks, it's just crunching against the edge, and she's getting lots of arthritis from that. So from what you're telling me and looking at her x-rays, I think a hip replacement will make a huge difference to her.
For such a young dog, a total hip replacement is a major operation.
If we do nothing, she might be able to live for a few years, but it might be only 4 or 5 rather than 8 or 9 or 10. So I think it's also quality of life and quantity of life.
It's better to know now. I think we've tried to kid ourselves for a while, just going, oh, it's not that bad.
It's not good that she's just constantly rubbing bone on bone when she walks. She hides it well.
It's expensive, it's invasive, and there is the potential for things to go wrong. All right, come on, you with me.
Brooklyn will be the first hip replacement ever performed at Sash. Everybody has a lot at stake.
I do feel almost a sense of fear and you know, a sense of responsibility that if something does go wrong, and I've kind of pushed them to be proactive about it, You know, it's not risk-free, and we just have to keep our fingers crossed that she's in the successful group.
I'm getting nervous now.
The surgical team is preparing for Brooklyn's hip replacement.
So my incision's here.
Yeah, it's a little tense. Absolutely. There's a lot to gain and there's a bit to lose. And I think because this is Sasha's first one, it's exciting. First incision.
This is major surgery for a 1-year-old dog.
It's a ball and socket joint we're replacing, and the cup is the socket part of that joint.
Okay, and you'll be able to tell me if I'm getting in. Ready?
In human terms, it would be the same as a complete hip replacement for a 14-year-old.
We're putting a metal rod down the middle of the thigh bone that's then going to attach to part of the ball and socket joint to make up the hip. So we'll push it down and just hammer it in and it'll stay there. The biggest problem with this part of the procedure is us actually splitting the bone. And if we do that, that's a major problem. Try that.
Yes. Position looks good.
Overall, I think it went well.
Nice. It's perfect canal fill.
We had a few hiccups. This is our first one, and I sort of half expected it wasn't going to go perfectly. It was a little frustrating.
The biggest threat now is an infection setting in around the implants. It will be 2 months before Andrew can tell if Brooklyn will make a complete recovery.
It is high stress because the implants themselves are $2,500 worth of just the implants. It's high stakes.
I'm nervous. I'm nervous to see her. I'm just worried that she's in pain or that she's not really sure what's going on.
There you go, darling. It's all right.
The next day, Ollie and Sasha visit the hospital's very first hip replacement patient.
Brooklyn is doing really well. 24 hours post-op, she's using the leg. She's tentative on it, but she doesn't have any major problems. Who's that? Hello, darling. You're a good girl. Sasha looked a little gobsmacked. I don't think she realised exactly what was going to happen. I think she saw the size of the incision and was a bit, oh. All right, sweet, come on then. We'll get you back.
1 more week and Brooklyn will be ready to go home.
If she were a human, she'd still be in bed, or if she wasn't in bed, she'd be on crutches and really hobbling in a hell of a lot of pain. I'd see my father-in-law go through it, and she's doing much better. Good girl.
Come on the stick.
2 months later, and it's a great result for Brooklyn as she runs and plays pain-free.
She's just never tired and never sore. It's really, really amazing.
Oh, she feels so much more developed in her muscles, and she just looks great.
You see her now and then you realise how bad it actually was for her, yeah. Definitely stoked we did that, you know.
She is our first hip replacement, and it's successful and everybody's happy, so it's something that the surgeons can be really proud of.
Hey, how you going?
Good, how are you?
Good. Just from the table, everyone's telling me to come here for the fish.
Yep.
What's the fish that everyone wants me to try? Is that on your menu?
No. I think he may have been stitched up here. Come on over. His name's Fatso. We call him Fatty.
Turns out Chris has been lured here for yet another patient. Fatty is the famous pet of restaurant owner Mia.
I'm pleased that you're here, actually.
What? I'm coming here for a meal.
Hey, you can have a meal. Don't worry about that. The thing is, he's just had this little growth on his head. It's been on his head for, getting on to a couple of weeks now.
It looks big. I mean, it's certainly sticking out the top of his head quite a bit, and it's in a very sensitive area between his eyes there. So it would be at the stage now where you'd think it'd have to be worrying him.
With Fatty in the pond, it's hard for me to get a really good look at that lump, but going how quickly it's grown, my worry is that it is cancer. It's getting to the stage where it's going to be growing into his brain or into his eyes.
Oh.
And then it gets really nasty, and that's what worries me. I mean, we have 2 options here. We can sit back and just let Fatty live his life, but it's growing quickly. Unless it's removed, it's going to really start playing havoc with him pretty soon.
Yeah. It's definitely a worry. Because, I mean, it's so big. It must hurt. I'm hoping that it's easy fix.
If there is something that can be done, and don't laugh, with surgery...
Surgery on a fish?
Yeah.
You're kidding me, right?
No, I'm serious. It is done. Not that often, but it is done. And that, to me, may be his only option.
It might seem like it's a bit over the top and overly dramatic to operate on a goldfish, but why is Fatty any different to a dog or a cat or a pet bird?
The kids love him, and we love him. He's part of our family.
He's some sort of local identity, is he?
Yeah, actually, a regular gave him to us because he outgrew their pond, and we've had him for 2 years since we've been open.
He has family, he has friends, he has fans, and he has feelings. So if there is an opportunity to operate on him, I'm going to take it.
I'm in the process of writing a book about Fatty, so I'd like to just get it fixed and hopefully have an ending to a story. Nice ending.
You're making it easy.
No, I'm not making it easy.
And of course, the final chapter, it's not written. The final chapter, it gets written based on what happens. It's a lot of pressure.
And we have to anaesthetise him in a totally different way to how we do every other animal, so it'll be tough, but I'm hopeful.
Got the right man on the job.
Well, let's hope you mean that.
If this doesn't go exactly to plan, then things could literally go belly up very quickly. Doug.
Wow, Chris.
How are you?
What have you got there, mate?
It's good to see you, mate.
Oh, look at that. That's a big lump for a little fish, isn't it? Come on, we'll see what we can do.
Righto, mate.
In Cairns, Chris and his tiny patient Fatty have arrived at the Marlin Coast Veterinary Hospital.
You can see it. It's a pretty decent lump. It really jumps off the top of his head there. It's almost got two parts too, that bigger part over to one side, and then just towards the front there's another small little lump there.
Yeah, it's going to be very difficult to get out.
Yeah. He just doesn't have a lot of skin to play with on that forehead of his. That's what worries me.
Dr. Doug English will be assisting Chris with the delicate procedure.
The lump's got to come off. Hopefully the fish will be tough enough to withstand that surgery, but otherwise he's going to die. That's a big lump, and if it's growing rapidly, it's some sort of a cancer for sure.
Adding to the pressure, this is the first operation Chris has ever performed on a fish.
Fatty has to be incredibly tough to get through this because this is way out of his comfort zone. It's just a massive, massive ask for him to get through this.
So my worry is that if things don't go to plan here, it could get nasty quickly. Based on how much water is in this tank, we work out the dosage of the anaesthetic, and then it goes into the tank and hopefully swirls around, and in that time, it absorbs it through his gills. Here we go, Fatty. All right, buddy, have a good sleep. You see already he's started to slow down in there? Yeah, he's ready. All right. It doesn't get any more foreign for a fish than being out of water. So the fact is I had to be quick and precise and get this operation done as soon as I can. I'm ready, so I'll get him out and then we'll get going.
To keep the little fish alive, oxygen will need to be constantly pumped through his gills.
Doug's job is as important as mine because that is to make sure that Fatty's gills are oxygenated and also that he gets the anaesthetic drug through his system at all times. If Fatty's oxygen levels fall too far, then he won't make it through.
We need as much water over the gills as possible.
I'm just trying to cut as close to the edge of the lump as possible because we just don't have anything to play with. There's no spare skin really to get this back together, so this is going to be quite a difficult removal.
As if operating on a patient as tiny as Fatso isn't hard enough, he flies off the table and my heart nearly stops. We now have to get him back into that water as soon as we can. Okay, that's out. Yeah, so that's it there. A decent lump. When I get the lump off, it's firm and there's no pus inside it. I've got no doubt that this is a tumour. But I've managed to get a good margin around the outside, and the fact there's bone underneath means it's unlikely to have spread. What I do know, though, is that if it wasn't removed, it would have killed him.
Can we just avoid the wound for just a second? I'll put some super glue on.
Now the lump is off, Chris will seal the lesion with super glue.
He's been left with a pretty big wound on his head, so it's a lot for him to get through. Doug's doing a great job of flushing those gills with the water that contains the oxygen as well as the anaesthetic drug, but still, Fatty just doesn't look right. His eyes are starting to roll.
It's a bit of a worry, eh? Because he looks dead.
Fatso's now been out of the water for 15 minutes and his body clearly isn't getting the oxygen it really needs. We have to get him back in the water right now if he's to be any chance.
Just give him...
In here.
There's just no movement at the moment. I don't actually know if he's alive right now. Come on, Fatty. I mean, normally he flaps his own gills around as a way of getting that oxygen in, but I'm trying to do it a bit for him now.
I'm just worried that Fatso's been out of the water for too long. Right now, it's not looking good.
There's no way he couldn't have gone into some sort of oxygen debt there. Come on, Fatty. Come on. There you go, a bit of movement.
At last, Fatty gives Chris the sign he's been waiting for.
So he's starting to really gasp in and try to get some extra water into his gills. So he's coming around. Wow.
Need a drink after this.
I think I'm okay. It was a very stressful few minutes getting that done, and Fatty is now swimming around, and that is a big relief. He's looking good now, isn't he?
Yeah, thank goodness.
I think he's going to make it through.
We did well.
And best of all, you can still eat at that restaurant.
Yeah, thank goodness. I love that restaurant.
All I want to do is get Fatty back to the restaurant as quickly as I can so I can relax and Fatty can see Mia. Mate, thank you. Great work. Oh, let's get you home, huh? Did someone order some fish?
How'd you go?
A very special fish.
Oh my God!
Look at him.
His lump's off.
I know. He looks great. He looks amazing.
Oh, Fatty. Oh, that's great. He's only a goldfish, but, you know, he's part of the family, so, yeah, Chris has done a great job. Very happy. Thank you so much.
I'm so excited. I love it. I'm so excited.
This is the first operation you've done on a fish too, yeah? Or is it not?
Who told you that? Yes it is, all right?
Well done.
And it went okay.
Yay!
That was hands down one of the best reactions I've ever had to any patient coming home, and it's almost as if she didn't quite expect him to come home. And look, I don't want to put words into your mouth. The final chapter of this book sort of writes itself. Just be kind, all right?
It's a happy ending.
It is.
Thanks, Chris.
It
That's
is.
so awesome.
I've got to say, when I first walked in here and was told about how amazing Fatty is, I thought, you know what? He's probably special, but after spending a few hours with him, I get it. Fatty's a big deal. It deserves to be. Thank you.
There you go.
Cheers, Fatty.
We noticed that she had some little holes in the top of her mouth. There's a bit of blood around them. So I really have no clue what's going on or what she's done, but it looks like it might be something to worry about.
I'm gonna fix your mouth. Yeah, we'll make you all better.
Callie is definitely my little baby. She's spoiled beyond belief, so I want to make sure that there's nothing wrong with her.
So what's happening?
She likes to chew lots of things.
Yeah.
She's always chewing sticks and rocks and that. But I'm not sure if she's punctured something or got like a hole from chewing on something.
Sure. So I'm just going to have a look in her mouth and see if we can work out exactly what's causing this problem. Oh, doesn't look good. It's only when I open up her mouth that I notice that her canine teeth are sitting far back and they're actually digging their way up into her palate, and that's not normal at all. Those bottom canine teeth, they're actually not sitting where they should be, and what they're doing is they're burrowing up into her palate and they're making those little ulcers, and if we don't do anything about it, those canine teeth will just progressively burrow through her palate, and eventually, in the worst case scenario, they can almost make holes right up into her nasal cavity.
That's pretty bad.
Yeah, it's pretty serious if we get to that stage. The best thing we can do is try and treat her now so that it's not going to progress and end up with a serious surgical problem. If we don't treat it, it's going to cause her lifelong pain, discomfort, difficulty eating. It's something we really need to treat straight away.
It's okay. She's just a little baby, so I want to make sure we can do whatever we can to help her. Do the best.
Hey, this is Callie.
Hi, Callie.
And Alana.
Hello.
Lisa is hoping specialist veterinary dentist Nadine Fiani can find a solution to help the Staffy.
It seems like her lower canines are not occluding in the way that they should. They're just not lining up. But I'd love your opinion on what we can do.
Let's have a look inside. Let's open up that little mouth. Wow. You see the dents right in the roof of her mouth? That certainly does not look right at all. Wow. So this is a pretty nasty problem. You're absolutely right, Lisa. The first thing I could see was that her two lower canines, her big fang teeth, instead of sitting in this sort of angle, they're actually sitting a little too upright. They're standing up. And what that means is when Callie closes her mouth, those two fang teeth are now poking up into the roof of her mouth, and they're causing dents. They're causing indentations or trauma to the roof of her mouth.
Is there something we can do to help her?
She's very lucky. I think we can probably put on some doggy braces.
Doggy braces, sure. I did not think that they were going to say that she needed braces. I'd never ever heard of a dog with braces. So is it like human braces? Or?
They're a little bit similar to what people can have sometimes on their teeth. We're going to move her upper canines back, and once there's a bit more room, we'll try and shift the problematic lower canines out of the way so that she's not having that painful problem anymore. We're not trying to make her win a beauty contest, we just want her to be comfortable.
Yeah, I don't want her to be in pain, so...
Oh, that's good.
She's the most loved member of our family, so anything that she needs, I will do for her.
Callie will be a pioneer and one of the first dogs ever to have braces fitted at Sash.
Callie's provided us the perfect case for it, and the beauty of this procedure is that it's completely non-invasive.
As horrible as Callie's problem is, the exciting thing is we can put braces on her to fix this.
Hey, you're going to get braces on very soon.
Stage 1 of Callie's orthodontic treatment will take place later this afternoon. For now, it's time for Alana to say her goodbyes.
We'll see you soon.
It's pretty amazing that we can do this for her. I'm sure some people are going to think I've lost my mind putting braces on my dog. And they might sort of think I'm just doing it so they look pretty. But we're going to do this so she isn't in any pain anymore.
All right, sweetheart. I'm going to go to sleep.
At Sash, 7-month-old Callie is about to undergo the first of a series of complex procedures to fix her misaligned teeth.
There we go.
If we were to leave Callie's mouth as it is, it's only going to get worse. And what will happen is those two lower canines, those two lower fangs, are just going to keep digging deeper and deeper and deeper into the roof of her mouth. Wow, it's quite the hole. What we're looking at here is the trauma that's happening in Callie's mouth. So these two dents in the roof of her mouth are caused by the lower canines. Every time she closes her mouth, they poke straight into the roof of her mouth. So that's really uncomfortable. So our aim is to eventually be able to move these two canines outward so that they're sitting on the side of her jaw rather than inside the roof of her mouth.
The first step today is applying braces.
We're going to cement on some metal buttons onto her teeth. It's a very delicate procedure, and where they go is very, very important. We just need to let that sit for a minute.
The buttons will hold elastics that will start moving the problem teeth to their correct position.
We have to be very, very careful with how much tension we apply to these teeth. 1, 2, 3, 4, 5, 6. If we put too much tension, if we try and move that tooth too quickly, it could end up killing it, and that's not what we want. That could lead to a whole host of problems. So we have to take our time, we have to measure everything, and we have to make sure what we're doing is spot on. There we go. Perfect.
Stage 1 of this long and complicated process is now over.
I think the buttons and the chains look great. They don't feel like they're gonna come off, but she is a puppy and we have to be so careful with her, so she's not allowed to chew on anything because they can come off quite easily.
Oh, it's all right.
Callie will sleep off her sedation and hopefully be able to go home with her owner Alana later today. At Sash, Pioneer patient Callie has recovered from her anaesthetic after having a set of doggy braces fitted.
Come on.
Specialist veterinary dentist Nadine has given her the all clear to go home with owner Alana.
That's your mummy coming to get you. Callie is doing amazingly well this afternoon. You wouldn't even imagine that she was anaesthetised only a couple of hours ago. She's right out of that anaesthetic, no problems at all. Oh my goodness. So much for sedation.
I cannot believe that my dog has braces. I think it is so funny, but hopefully that really, really helps her. So I'm pretty excited.
Hello. 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 You're beautiful.
Callie's next visit will be in 4 weeks.
Oh, thank you for that. That was lovely. I really do hope that we start seeing that upper canine tooth, that upper fang tooth start to move back gradually, and to do so in a slow and steady fashion, and that we don't end up with any complications from it.
Bye, good luck.
Getting sleepy. There we go.
At SASH, the second stage of little Callie's marathon orthodontic program is about to begin.
It's time to get these braces off.
If the braces have done their job, Callie's upper canine teeth should have started to move back.
Oh my God. Out it came. Oh, beautiful. Callie still has those little ulcers in the roof of her mouth, but it's looking pretty good and no longer causing her any pain or discomfort.
The next step is to use dental putty to construct a temporary plate that will start pushing Callie's lower canines clear of the roof of her mouth.
We want to make sure that everything fits together and that we shift the teeth as quickly and as efficiently as possible without causing any problems later on.
Little Callie is now more than halfway through the pioneering program to correct her teeth.
Yes, that's very, very nice.
It will be another 4 weeks before she's back in to see if the plate has worked.
Now we'll just have to wait and see if the teeth shift like they should be. There you go, Callie.
Today is a huge milestone for courageous Callie.
You're a good girl.
After weeks of intense treatment at SASH, the Staffy pup is back for what's hopefully her final procedure.
We're going to be removing her orthodontic appliance today, and hopefully that'll be it. We'll be done.
That's such a good girl.
The first step is removing Callie's plate.
We're going to score the appliance itself, and then we're actually going to crack it off bit by bit. We do that very carefully because we don't want to hurt the teeth underneath it.
Today's the big day. Callie is having her plate removed. So excited to see how it turns out.
Oh, there we go. The whole lot just came off. Thank you. Fantastic. So I'll just get the last bits and pieces off. We are going to just make sure that everything's fitting together okay. There we go. I'm always nervous at this part of the procedure because it's really the moment of truth to see if all the work that we've done has actually been successful. So fingers crossed our teeth fit together properly. Oh, beautiful. So we can see immediately that now her lower canines are on the outside of her upper canines, which they weren't before. Previously, they were just sitting right in there, inside her palate, inside the roof of her mouth, and they were causing all manner of trauma. So that's no longer the case. The braces, the plate, everything has done its work. Our lower canines are now in completely the right spot. They're not going to poke through the roof of her mouth, but most importantly, she'll be very, very comfortable. Aren't you the prettiest girl now? You're so pretty. Lovely teeth that don't hurt.
Callie, you're going home, sweetheart. You're going home. Come on, somebody's waiting for you. I know.
Later that afternoon, Callie has slept off her sedation. and is ready to be reunited with her devoted owner Alana.
I can't wait for Alana to see Callie's new smile. They have been through weeks and weeks of procedures, and her devotion and dedication to her dog is quite remarkable. I just can't wait for her to see her little girl at the end of the day. She is going to be so excited. Go.
Hello, Mama. Hello. Hello. Yes. Hello, princess. Hello.
Callie. Come on. Show Mum your teeth.
Show me. Oh, look how pretty they are.
Oh, Bubba. Got a brand new smile.
Thank you so much.
My pleasure. It's really exciting to have been involved with Callie's treatment. She's now gone from a dog that had a painful mouth to one that's got a beautiful, normal functioning mouth, and she'll go on and lead a happy, healthy life.
Thank you.
Thank you.
Come on, Papa.
See you, Callie. Yeah, she thinks your teeth are beautiful.
Come on, let's go.
It was definitely worth getting the puppy braces for Callie. We can be happy knowing that she's got a long, happy, healthy life ahead of her with plenty of love from all of us.